Part of the vision when we set up the Institute of Health Visiting was that we really wanted to have a single place. We described it as a centre of excellence and a centre of excellence for health visiting. Very much it's about improving and developing the profession. So the Institute itself is very dependent upon its members, its associates and fellows feeding into the Institute all that is the best about health visiting, but also feeding out and being able to speak up for health visiting. The particular role of the fellows in the Institute is it's really to be that backbone of the Institute. It's to be the experts and the leaders and the role models, to be a source of inspiration for the profession, and to be supporters for the Institute itself, to ensure that we really do have the expertise to put into practice the aspiration that we have to be a centre of excellence. I think one of the things that we're trying to do in the Institute of Health Visiting is to make it easier for people to get to grips with some of that new knowledge, trying to get some bite-sized bits of information so that health visitors can download an information sheet or go to an updating button on the website or get some continuing professional development, because there is just so much that we have to get to grips with the whole time. All working together really to develop the profession, because our eventual aim, of course, is to improve outcomes for children and families. So we're not there particularly for the health visitors themselves, although we're very interconnected with them. We're there for the profession and for the good that that profession can do, which is what we all believe in, I think. I think even though it's a very young organisation, it's already proved its worth, and it would be really missed if it was suddenly disbanded, because it's being able to fill that gap that previously existed in being a voice for health visiting, being a centre for education and training and professional development for health visiting, for being a focus for discussing the career and the future of the profession of health visiting, and for the research and the impact of what it is that health visitors and health visiting can achieve in terms of the good for the public health and communities and families. The Institute of Health Visiting has very quickly become the place to go to from government, from the Department of Health, from all of the various health-related committees and organisations. So the Institute of Health Visiting has become a very strong voice for the profession, and through the profession for children and families.